Your nursing care for the child who has CP must be highly individualized, related to the type of disorder and level of severity. Major issues are skin integrity. It is important to assess for redness or other evidence of pressure areas. Also keep the skin clean and dry and reposition the child frequently. Prevention of contractures or deformity through the use of splints or braces, frequent changes of position, and passive range of motion and stretching exercises. Assistive equipment such as braces or walkers should be checked frequently for correct alignment and the presence and correct functioning of all parts. Wheelchairs and crutches should be adapted to fit the individual child. Postoperative care includes extensive rehabilitation as well as immediate care related to post-op complications such as bleeding, infection, DVT, and atelectasis. Feeding difficulties include poor suck and swallow, hyperactive gag reflex, and vomiting. It is important to use adaptive devices as indicated and make sure the child is positioned properly with adequate support of the head and neck. It is important to encourage the child to be as independent as possible, using adaptive devices to facilitate self-care. Also remember that parents are typically the experts in issues related to the care of the child and should be a central part of the multidisciplinary team. For example, the parents will be an important source of information about what types of play the child enjoys. Play, both alone and with other children, must be encouraged as it is an important part of the life of any child. So is rest. Daily activities require the expenditure of a great deal of energy, yet the child with CP finds it difficult to rest and relax. You'd provide an environment that facilitates rest, limits overstimulation, and allows the child plenty of time to accomplish ADLs. Also, in collaboration with the healthcare team, you'd provide the family referrals to community and national resources that will support them and their child in coping with CP.